Preterm labor. Introduction. If a pregnant woman has 3 or more contractions per hour, this may be a sign that the labor has started. Select true or false. Correct. When the contractions start, they usually happen about every 20 minutes or 3 times per hour. As they keep happening, there is less and less time between them. The body is ready to push the baby out when there are only 5 minutes between contractions. Dilation refers to the widening of the cervix during labor. Select true or false. Correct. During the dilation and effacement stage, the cervix becomes 10 centimeters wide. This is called dilation. Is preterm labor when labor begins at 40 weeks of pregnancy? Select yes or no. Correct. 40 weeks is considered a full-term pregnancy. Preterm labor is when labor begins before 37 weeks. Do all preterm labors that result in premature delivery have complications? Select yes or no. Correct. The earlier the baby is born, the greater the chances of health problems. Lisa has been having false contractions in her 36th week of pregnancy. Today, she counted her contractions over a period of 40 minutes. She counted 8 in 40 minutes. Should she call her healthcare provider? Select yes or no. Correct. Lisa is having 8 contractions per 40 minutes. She should go to a healthcare facility or call her healthcare provider right away. Which of the following may increase your risk of preterm labor? Choose one of the following options. 1. Not drinking enough water. 2. Diabetes. 3. Gaining too much weight. 4. All of the above. Correct. Are medications always successful at stopping preterm labor? Select yes or no. Correct. Medications and other treatment options are not always successful at stopping preterm labor. Can preterm labor always be prevented? Select yes or no. Correct. It is not always possible to prevent preterm labor. Thank you for using Explain.